Can you see my screen?
Yeah.
Okay. So Nellie, you already know this case because I texted it to you. But for anyone else, this was the pre-contrast imaging through the liver and abdomen. So anybody have any clues as to what's going on? And they didn't accidentally inject early. So what do you think about like the vessels and the contrast?
It looks contrasted.
Yes. Yeah. So how can we get faked out pre-contrast where the vessels look like they're enhancing, but we have not given contrast? And they didn't get a recent exam like a brain MR or anything like that. And they didn't get a recent CT. It was actually something that they showed a case on at the SCBTMR or SABI unknown case panel. And it was like a hemangioma that was filling in strangely. And any other guesses, anyone online?
I don't know this one.
Yeah, this was a cool, good learning case for all of us. So this is a patient who has iron deficiency anemia and has been getting ferriheme or Ferumoxytol. And so Ferumoxytol is an agent that used to be like a kind of promising agent for MRI. It basically can like distinguish metastatic rectal cancer nodes from non-nodes. But because there were so many anaphylactic reactions and allergies, it got a black box warning. And so in the United States, we can no longer use ferriheme except like off-label. But people are using it as iron treatment for patients who have iron deficiency anemia. So it will affect your MRIs. And it's a blood pool agent. So it'll like stay in your blood pool. The biggest effect is in the first 2 days, but it can last up to 30 days.
Wow.
So if you see this, and it really affected this exam because we were screening for HCC and we couldn't really see, we didn't have a proper arterial phase. We actually saw stuff on the in phase and T2, so we're still unclear about these lesions that we saw, but we didn't see them on any of the post-contrast imaging, which was all basically distorted because of this Ferumoxytol. So, any questions?
No.
It'll also make hemangiomas look weird. So the case that Gane showed, the hemangioma looked like T2 dark, but it was because it had so much iron, the Ferumoxytol pooling in the blood in the hemangioma. It was cool.
Yeah, we use this for MR angiograms, and since it has a safe renal profile, many of the nephrologists ask us to use this for their liver scans, and we usually try to deny that because it's not very good for evaluating the parenchyma.
Yeah, it's good. It's a good blood pool agent, and supposedly also helpful with these lymph nodes.
But patients, like if you're looking for liver lesions, even if they're on hemodialysis, I mean, ACR has issued a statement basically saying like it doesn't matter, right? Like anyone can get gadolinium irrespective of renal function.
Yeah, I mean, I think people have varying policies, but now with the macrocyclic agents, people are thinking that the risk for NSF is extremely small, and those are the ones that have the safest profile as far as brain deposition. So those agents, people have been using them fairly liberally, even if they're on dialysis or even with a low GFR.
Are the macrocyclics, are they categorized as type 2 agents, like multi-hands?
Multi-hands is not macrocyclic. The macrocyclic ones are Dotaram, ProHands. Yeah. The multi-hands actually still has brain deposition, and that's why it got a dinged in the recent FDA warning. So we just switched from multi-hands to ProHands.
Oh, gotcha. But in terms of renal function clearance, like with the ACR, they issued a statement last year saying like type 2 agents like multi-hands are completely safe for patients with renal.
Yeah, for NSF. Yeah.
Yeah, for NSF.
That's for NSF. Yeah. But then this new thing came up with the brain deposition. So then, even though those were safer, people have been switching to the macrocyclic.
Gotcha.